Hello everyone, I am Dr. V. Mohan, patron of RSSDI and past president, and currently the chairman of Dr. Mohan's Diabetes Specialty Center and president and director of the Madras Diabetes Research Foundation. It gives me great pleasure to welcome you all to Chennai first of all, and secondly to congratulate the organizers of RSSDI 2022, particularly my good friend, colleague and student Dr. Vijaykumar and his whole team of the organizing committee of the Tamil Nadu chapter of RSSDI for organizing this mammoth conference which is called as RSSDI 2022. This year is very special because it happens to be the golden jubilee or the 50th anniversary of RSSDI. RSSDI was started by Professor MMS Ahuja, but two people from Chennai played a very important role in this. My late father, Professor M. Viswanathan, and the late Professor Sam G.P. Moses. They were the founding members of RSSDI, and in fact, some of the early meetings of RSSDI took place in Chennai in 1972. And therefore, it's very appropriate that exactly 50 years later, we are celebrating the golden jubilee of RSSDI. I'm also very proud that the silver jubilee was also conducted in Chennai, and exactly 10 years ago, when I was the president of RSSDI, we conducted the 40th anniversary conference of RSSDI also at Chennai. So having organized some of the early meetings and then the silver jubilee and the 40th, this one becomes very special, being the 50th year. Now, everything about this conference is perfect, and if I was to give a score on 10, I'll probably give 15 on 10 because everything from the scientific content to the halls, to the arrangement, to the hospitality, to the exhibition area, the scientific content, everything is perfection to a P or to a T as they would say it. And kudos to the entire organizing committee, particularly to Dr. Vijaykumar, who's worked so hard to make all this happen. The scientific committee was very carefully drawn up by Dr. Makkar and his colleagues, and they have also done a marvelous job. I mean, having a conference in 4 or 5 halls is no joke. And one of the things I'm very happy about is the attendance at the conference. If you look at the halls, at any time, early morning I came today, and the halls are already showing so many people, despite having 4 or 5 halls going on simultaneously. That shows two things. Number one, how much interested people are in diabetes in India, how eager they are to learn. Second, the credibility of RSSDI. And thirdly, the credibility of Chennai, because Chennai has veritably been the capital of diabetes care in this country. My father, Professor Shunmugavelu, started the first diabetic clinic in India in the year 1940, post-independent India, in the year 1948 at the Stanley Medical College and Hospital in Chennai. So Chennai has a rich and hoary tradition of hosting diabetes events, of research in diabetes, and it is veritably the diabetes care capital of India. So welcome to Chennai on my own behalf and on behalf of all my colleagues, and congratulations once again. I have two major commitments at this conference. The first is my talk on heterogeneity of diabetes. Here I describe the subtypes of type 2 diabetes. We know that diabetes is not one disease. It consists of type 1, type 2, gestational diabetes and other types and so on. But type 2 diabetes itself is of different types. My daughter, Dr. Anjana, and myself and our colleagues in collaboration with the University of Dundee published a paper which was called as the INSPIRED study. INSPIRED stands for India Scottish Partnership for Precision Medicine in Diabetes. So we are able to identify 4 subtypes of type 2 diabetes: a severe insulin deficient variety, SID variety, a mild age related variety, MARD, and these 2 subtypes were same as what is reported in Scandinavia by Leaf Group and colleagues. But we identified 2 other subtypes which are peculiar to Indians: an insulin resistant obese diabetes or IROD and a combined insulin resistant deficient diabetes. Each of these types is important in relation to the classification, in relation to the treatment, as well as in relation to the prognosis. So I hope you have had an opportunity to hear this talk at this conference, and also to read the paper which is published in BMJ Open. Today it is widely accepted. This classification that we produced of the 4 subtypes of diabetes, type 2 diabetes in Indians, has now been replicated in the South Asians living in the UK, in the Pakistani and in the Bangladeshi population also. So it looks as if this is common to the whole of South Asia. I'm also talking in this conference about taking part in a symposium on finerenone, which is a new molecule for treatment of diabetic kidney disease. Till now we have had some agents for treatment of kidney disease, but there's always been that gap. And that gap, I think, is going to be beautifully filled by this new molecule called as finerenone, which is very exciting. So all in all, I think it's it's been extremely pleasant and a humbling experience for me to be at the Golden Jubilee celebrations of RSSDI. And I wish to thank the organizers and Macleod for asking me to take part in this program and to share my thoughts. My very best wishes to all of you. Thank you.